Hello, everybody. I'm Dr. Maureen Mason, and I'm here in the medical office of Dr. Virginia Lee, my acupuncturist. She and I met in the integrative health field, and we're both fans of integrative medicine for the underserved, which is developing programs to help those in the socioeconomic groups where they may not have as robust resources for services. So we liked each other right away. We've known each other for a few years and bumped into each other at conferences, but I'm here today to receive acupuncture. But first, she asked me to give a few minutes on pelvic health, which is my specialty. I'm a physical therapist with a master's and doctorate in physical therapy. And over time, I started in neuro, then I went into orthopedics, and then pelvic girdle problems, sacroiliac joint, pubic bone pain, and then urinary incontinence. These were things I had to learn to treat. And interestingly, I wasn't interested in the beginning with urinary incontinence. And then I started studying bladder problems, bowel problems, pregnancy and postpartum. I experienced 2 pregnancies and births, learned a lot. And I've experienced menopause, and I've learned a lot through that too. So we can read things in books, but when you're affected personally by things, then you can take a deep dive too. So what I want to talk about today just briefly is a profile of pelvic physical therapy. So people sometimes come in, they're like, why am I here? Pelvic? My urologist sent me, my gastroenterologist sent me. Well, as an integrative provider, and most pelvic PT is integrative, we look at how you're breathing. That affects your pelvis. If you're the type of person that's a go-getter and pulling up all the time, that stress, when you're lifting your chest up in those sucking in inhales, or dancers, gymnasts, football players, where you have a lot of tension, that can be pulling up your pelvic floor too. Maybe you have back pain, maybe you have hip pain, maybe your pelvic floor muscles are too tight. That can limit your ease of emptying your bladder, bowel movements. It can have pelvic floors being too tight, can limit your intimate functions so that your responsiveness with intimate functions is less because your sympathetic nervous system's turned on too much, you're not getting that blood flow, and so on and so forth. So pelvic PT provides evaluation, look at how you walk, how your hips move, your back moves, and we may check your external pelvic muscles and your internal if it's appropriate. What I mean by that is some people have had a lot of troubles in their life. They may have had some hard falls on their tailbones, back injuries. They may have had trauma from medical treatments. Women's gynecologic exams can be painful. We know that the incidence of female pelvic trauma and sexual abuse happens. And so as a provider, the patient's the boss. We always use techniques that someone's comfortable with, that they feel good about doing, a type of movement patterns, little exercises during the day versus a rigid exercise machine, or routine. So, and just a quick minute on your pelvic floor, the anatomy. Oh, by the way, I have a book. So pelvic rehabilitation, only took me 5 years to write. Maybe AI will swoop it up and put its own version out with ChatGPT or Claude, but I'm the founder of this book. It's Pelvic Rehab Across the Lifespan. So anatomy, kids, teens, menopause, pregnancy, all the way up to integrative care and nutrition. And this is on Amazon and also Handspring Publishing. And when you come to see Virginia, it's in her office. You can leaf through it. It's got a lot of fun exercise pictures and anatomy and programs. So your pelvic floor automatically works to keep you continent. So hopefully your bladder's not leaking and your bowel's not leaking, and people feel funny even talking about this topic because it's the very private areas, and people actually, if they do have a problem, if you're listening to this, there's shame, low self-esteem, anxiety and depression associated with pelvic health problems. Who wants your bladder to leak? Is there going to be an odor? Do I have my pads? Should I be going out? Bowel leaks are even more troublesome, disastrous, possibly, for social situations, etc. So it's a subject of a lot of humor. People talk about pooping and peeing and stuff like that, but just know if you have a concern, it's natural to feel shy about it. Okay, here's a female pelvis. These are the bones of the pelvis. And then look inside, there's a whole hammock of muscles that is your pelvic floor. And then there's a surface group of muscles here, which we're not taught in physical therapy school. I got a master's, I had no idea what was here. So, but underneath the labia majora and minora in the female, there are muscles that form a triangle called the urogenital triangle. And we call it the UGT, but it lines the ramus of the pubic bone, and then it goes across side to side between the tuberosities, and then there's a vaginal ring muscle. And females have their urethra hidden inside of the labia minora, and women really can't even see this little urinary outlet of the urethral meatus because it's hidden. These cells that form the urethra are the same ones that form what's called the vestibule, this introital vestibule. So sometimes if women have a UTI, the urethra hurts, and then all of a sudden this inner perineal area starts hurting. They're buddies embryologically versus this being other tissue. So anyways, women can have different problems here with being too lax and loose postpartum if they've had a vaginal birth, or some hypermobility challenges, or they can be too tight and have problems from that too. So not everyone needs Kegels, tightening, pulling up, tightening. Some people need the opposite. And we might examine that over underwear, just going on these muscles here. We call it 3 o'clock and 9 o'clock. And we might just go across and say, can you breathe and relax? Relax your butt, relax your belly, relax your pelvic floor. And we may ask for a tightening. And then there's muscle testing procedures too. But that's an overview of your pelvic floor. Maybe your pelvic floor is working fine and you don't need anything for that. And here's a male view. Males typically don't have as much pelvic floor dysfunction, bladder leaks, pelvic pain, because of the pelvic floor is tighter. They have a very long urethra, less susceptible to UTIs. And we hear about the prostate a lot. Prostate naturally swells as men get older, but they can have prostatitis where there's inflammation in there. Swelling of the prostate tells the brain, hey, you gotta pee, you gotta go. So we see older men every half hour sometimes. So different procedures can be used for that. And I'm sure there's a plethora of Chinese medicine and other natural techniques that you could talk to your provider about that can help too, and also a lot of habits. So the male pelvic floor, this is just showing a line. There's the external anal sphincter, and there's a line that goes all the way under and to the proximal, the closer 1/3 of the penile shaft is lined with muscles. So guys, when they urinate, that muscle pulses a little bit to push the urine out, whereas women really have to relax a little bit more for urination. So that's a few quick minutes on pelvic floor information for you on the muscles, how it's connected to breathing, possibly, how it's connected to stress. Life phases influence our pelvic floor function, and we have different types of pelvic pain that may be ruled out, whether or not there's an infection, or certainly red flags are if you notice a big change in your bladder, you're having blood loss with urination or defecation, persistent pain, also swelling, unexpected swelling and weight loss. Those could be more serious signs of illness. Finally, a lot of people do develop blood sugar dysregulation, and with that, there can be overactivity of the bladder because the bladder is getting too much sugar in it, and all of a sudden people think, what's going on? And overactive bladders and thirst and fatigue, those can be signs of diabetes. And so don't just try to treat yourself by watching videos online. See a healthcare provider to get screened if you're having any of these issues, okay? So Maureen with Central Station Well, and so nice to meet you on this video here, and you'll be hearing more from myself and Virginia as we continue this series. As we say, namaste.